Welcome to Webinar Wednesday. I'm your host, Kelly P. Hodges, National Program Director for Sisters Network Incorporated. And this webinar series is being sponsored or hosted in partnership with Sisters Network and sponsored by Iman Cosmetics. And in partnership with our local community partner, the Breast Health Collaborative of Texas. And I will be facilitating today's webinar. Sisters Network Inc., for those of you who don't know, is a leading voice and the only national African American breast cancer survivorship organization in the United States. We were founded in 1994 by Karen E. Jackson. Sisters Network is governed by an elected board of directors and assisted by an appointed medical advisory board. The organization's purpose is to save lives and to provide a broader scope of knowledge that addresses the breast cancer survivorship crisis affecting African American women around the country. And Ms. Jackson, our founder and CEO, is celebrating 20 years of survivorship this year, so we're really excited about that. The Sisters Network is very excited about Webinar Wednesday. Our very first webinar was hosted in the spring on the subject of triple-negative breast cancer and was well received by the community, by our network, so we're excited to be able to bring you another webinar series. Thank you to those who participated. If you missed any of the webinars, they are on the homepage of our national website, which is sistersnetworkincorporated.org. I'm sorry, Sisters Network Inc., inc.org. A couple of housekeeping notes before we get started. Before I introduce our presenter, the question and answer session, Q&A, will take place at the end of the presentation. Please note your questions and hold until the end. We will make every effort to address all questions. Additional questions can be sent to Sisters Network, and we will send those questions directly to Dr. McCoy or his designated staff person to try and get you an answer as soon as possible. Sisters Network aims to provide useful and informative information to survivors, caregivers, health professionals, or just anyone who wants to know more about healthcare, breast cancer, and survivorship. So without further delay, I would like to introduce our speaker. Dr. Dan McCoy joined Blue Cross and Blue Shield of Texas in October 2012 and currently serves as Vice President and Chief Medical Officer. In his new role, he helps Blue Cross fulfill its mission to improve the health and well-being of its members and communities across the state. Dr. McCoy is an integral part of the company's statewide effort to expand access to health care in Texas and educate uninsured consumers about the coverage choices. Prior to his role, Dr. McCoy served as Interim Chief Medical Officer and Senior Medical Director. Dr. McCoy has had significant experience in the public policy arena, serving as Chair of the Texas Medical Association, TMA, Council on Legislation, and Chair of the TMA Political Action Committee, TexPAC. Dr. McCoy was also appointed by Texas Governor Rick Perry to the Texas Statewide Health Coordinating Council from 2012 to 2017. Dr. McCoy's professional affiliations are numerous, along with his community involvement: the Texas CASA Board, the Dallas County Medical Society Board, and the TMA Board of Trustees, to name a few. Dr. McCoy is also past president of the Navarro College Foundation and the Texas Dermatological Society. Dr. McCoy graduated summa cum laude with a bachelor's degree in biology from Tarleton State University, and he earned an MD at the University of Texas Southwestern Medical School in Dallas. So I said all that to say that Dr. McCoy is very, very qualified to present on the new healthcare law and you. So without further ado, I will turn the microphone to Vice President and Chief Medical Officer for Blue Cross and Blue Shield of Texas. Thank you, Dr. McCoy.
Well, Kelly, thank you very much. It is a pleasure to be here with you this afternoon and to talk about the healthcare law. It's certainly a very complicated act to talk about, and lots of confusion and information that can be shared. So I always look forward to opportunities like this to be able to share a little bit of that information, and particularly to engage in some questions and dialogue. So as we go through this presentation, if you have questions, please be sure and jot them down, and we'll try to address them as best as we can when we're done. and try to get you to the first slide. So the big question is about the first thing I'd like to talk about, particularly to stakeholder groups, is when you're talking to consumers, why do you need to get health insurance? And as you notice, the topic of our slide deck here is Be Covered Texas, and getting coverage is so important for helping your family and helping individuals. One of the biggest causes for bankruptcy in this country is medical expenses, and clearly having some insurance coverage adds an element of safety for your family. It also ensures that you have access. If you have a sick child and you don't have health insurance, there's an element of uncertainty about how you would actually get your child taken care of. Having an insurance card in your pocket helps to ensure that you could take your child to the doctor or yourself to the doctor without having to access an emergency service like an emergency room. Also, health insurance is often called managed care, and it's managed because it helps consumers manage medical costs. It helps to coordinate care between one physician and another, or hospital systems and another, and also in disease management programs. So having enrollment in a health insurance product helps to manage complex diseases better, like diabetes or heart disease. It also, in general, supports good health because of preventative healthcare services and people being able to get access to diabetes screening and colon cancer screening, all in an effort to help patients become more healthier. And then finally, health insurance is going to be more affordable. So the cost of health insurance is going to go down for many citizens in the United States because of changes related to the Accountable Care Act. And so that's one last reason why it's important for everyone to get health insurance. So what's new in the law? Probably some of the biggest things that people have heard about is the ability for children to stay on their parents' policies to age 26. That actually was one of the first provisions that ACA provided for, and many people in the United States are already familiar with that. It was a policy that was often found in group plans, but was missing in some states, and so this helped to harmonize that rule across all of the 50 states. The other change that occurred is that preventative services are included without paying a copay. By removing that copay provision, it helped to encourage people with health insurance to go to the doctor and get those screenings, because screenings can often identify diseases early and allow for interventions, which they do lower costs, but they also can result in a better outcome for the patient. And finally, it restricted the annual limits and the lifetime limits related to healthcare coverage. What that means basically is that if you were to have a serious illness, say as a child, then you don't have a lifetime limit on having access to health insurance when you are older as an adult. So what's new? Well, starting in 2014, the biggest change is that there is a change in our affordable ability to offer coverage. Several ways to buy, which we're going to talk about today. And for people who are eligible, there's going to be government programs to help pay for that coverage. So there's going to be either a subsidy or a government program that helps to improve the access. The other big change, and we're going to talk about a little bit later, is that pre-existing conditions were covered. And many times, particularly in the individual marketplace, people were denied coverage or access to individual insurance plans because they had a history of a pre-existing illness. And then finally, there's a whole change in what were considered essential health benefits. And basically, essential health benefits are a list of 10 broad categories of what you might consider common but essential items in maintaining your health. Things like outpatient doctor visits, hospital services, pharmacy, behavioral health, and psychiatric services are all examples of things that would be included in that essential health benefit category. The three critical elements that I want to kind of focus on here at the beginning, and the first one is guaranteed coverage. And starting in 2014, individuals will be assured of getting access to health insurance coverage regardless of their health status. And this is probably one of the broadest changes that's occurred related to ACA. There is no restriction now on coverage if you've had a pre-existing illness. And a good example would be if you were purchasing an individual product and you had a history of a heart attack in the past. Many times you might have found yourself in a situation where it was difficult to get access to an individual policy, but pre-existing conditions are not an issue anymore for people under the provisions of ACA, and you will be guaranteed coverage. And that's probably one of the most significant changes. The second one has to be the individual mandate. And certainly this has been in the press a lot. Most Americans will be required to purchase health insurance, or they're going to have to pay a penalty at the time of their tax filing. Now, initially, that penalty is going to be pretty low. And in fact, the first year, it's only about $95. It does escalate, though, over the next 3 years or so to increase to a level of about $695, which can be a fairly substantial penalty. Of course, it would be hoped that for most people would find that the health insurance on the exchanges or even off the exchanges would be affordable, particularly with government assistance, which means that for the majority of Americans that are interested in purchasing health insurance, it will be easy, and therefore they'll be able to avoid the penalty. The third issue I kind of want to mention in the biggest change that we've seen this year has to do with financial assistance. For the first time for many Americans, there's going to be some financial assistance or subsidy, you may hear that word, both for the premium of the insurance, that is the monthly cost. There could be an assistance for that monthly cost, and also for the cost sharing of these out-of-pocket expenses. And those are things like co-pays, deductibles, co-insurance that you might have heard before. So those two particular areas of subsidy or financial assistance are significant changes in the Accountable Care Act that are starting in January of 2014. In some states, there's also been an expansion of Medicaid to cover some participants, and I'll mention a little bit about that later. Also, there's been some changes, particularly in the benefits for children and young adults. We mentioned before about the pre-existing conditions, and that also applies to children, and that can be a very important factor. I mentioned heart disease in adults before, but there certainly are children that have significant health events like leukemia that could find themselves later in life having challenges getting an individual plan. Again, pre-existing conditions are no longer a reason for denied coverage. And we also mentioned that adult children can stay on their family's insurance until they turn 26. There's also new and expanded benefits for women. Probably the biggest one is maternity care. For a long time in many individual policies, maternity was not offered as a benefit. It would often cover everything but maternity. As part of those essential health benefits, again, for these individual plans, maternity care will be offered, as well as the preventative services that we mentioned before, such as immunizations, screening for osteoporosis, pap smears, and birth control. So let's talk a little bit about those preventative services. That's often a little bit confusing, like what's considered a preventative service. Well, the rules are pretty specific within the Accountable Care Act. One of them, the Affordable Care Act, part of it is to do with that the preventative services list are provided by a task force called the United States Preventative Service Task Force, along with help from the CDC and in the Health and Human Services. They're actually the ones that are going to determine whether or not a service is considered preventative or not. Also, women's preventative services do include contraception and breastfeeding. Now, there are certain exemptions you may have read about in the press that may apply for certain religious affiliated employers and certain nonprofits. The great thing to know about preventative services is that they are covered at 100% without the requirement of a copay or co-insurance. And examples of these would include evidence-based preventative services. That would be colon cancer screening, screening for diabetes, osteoporosis screening. Also, all routine vaccinations that would be considered routine by the CDC for adults and children would also be included in that category. And as you know, if you have children, that certainly immunization costs can be fairly substantial for children, particularly if you have more than one in your family. Prevention for children services are also included, and this has been, again, we mentioned before that a lot of the benefits that were expanded for adults also are included to expand to children, and these include childhood immunizations, periodic tetanus shots, and things like that. And then finally, the fourth area is prevention for women. And this can be things like we mentioned contraception, even expanding to domestic violence counseling, all in an effort to expand services that were routinely not covered as part of individual policies. I've mentioned quite a few times about for people with pre-existing conditions, and this is because this is a significant change in the way insurance is delivered in the United States, and that in 2014, pre-existing conditions will no longer be a factor in getting coverage. And so this is important for groups like yours and yourself to know, because there's going to be people that are going to believe I've been denied coverage before and I won't have a chance to get it again. It's important for them to understand that if they were denied because of a pre-existing condition, that's no longer a factor. The other issue is in the past, if members or patients did have pre-existing conditions, they often were charged significantly higher premiums, and that's also a significant change in the way the rules around insurance are written, is that you can't be charged significantly higher premiums if you've had a serious illness in the past. So those two factors, you can't be denied and you can't be charged a higher premium, are going to create a great opportunity for people who have traditionally not had those opportunities to be able to gain coverage and access to health insurance. I'm going to mention just a little bit about seniors. There are some changes in the health care law, just as we talked about with children, that also apply to seniors. Probably everyone has heard a senior talk about the donut hole, or the coverage gap for Medicare prescription drugs, and that's going to be slowly phased out. And until that's phased out, there's going to be a 50% discount on brand name formulary drugs that do fall in that donut hole, which has been a substantial cost to many seniors. There's going to be some other changes as well. There's going to be a subsidy reduction for Part D premiums, particularly for individuals with incomes greater than $85,000. There's several other changes as well, particularly related to freezing Medicare Part B premiums and transition services for seniors who are transitioning home from the hospital. The other significant change that's occurring right now, and is clearly an integral part of the rollout to the Accountable Care Act, is the creation of the health insurance marketplace. You may have heard this referred to before as the health insurance exchange. The technical name for it is the health insurance marketplace, and it is truly a marketplace environment where consumers can go out to a website and be able to not only to determine if they're eligible for a public program, but they can learn if they might be eligible for a subsidy, and they can view these plans and get an online shopping experience to compare and decide which would be the best plan for their particular family. It's a new way to shop, and clearly there's been some challenges, I think, with the rollout of the website. We're getting all indications that a lot of those challenges are melting away. I would want you to know that if you've had people that have attempted to access healthcare.gov in the past and they've been challenged because of either slow access speeds or some challenges with getting entry into the site, to encourage them to go back and try it again, because there have been some significant changes that appear to be that the website is working a lot better. But the way the system basically works is that you go on the website, you fill out some basic information, and the first thing that you determine is if you might be eligible for a program. And I'm going to talk in a minute about some of the requirements for eligibility and what would be required for you to be able to participate. The second thing is you'll get to learn if you qualify for a tax credit or a cost-sharing subsidy. I mentioned those before. That's part of that financial assistance in both purchasing the premium as well as helping the consumer pay for the co-pays and the deductibles and the co-insurance that will be available as part of these health insurance products. You'll also be able to view these qualified health plans. So you'll be able to shop, almost like an online shopping experience, where you'll be able to look at the different plans, the different co-pays, the different deductibles, how they stack up, and which would be the best one for your particular family. You're going to be able to see what these plans cost and what that cost would be in relationship to the subsidy that you're getting as part of that financial assistance. So you'll be able to determine which plan would be most affordable and most correct for your family. And finally, when you're done, you'll be able to enroll and actually purchase that qualified health plan on the site. So again, it's a new way to shop for health insurance. You certainly can contact a broker if you've if people have traditionally accessed in the past, but this is an opportunity for consumers to go directly to a website, determine their eligibility, determine if they get a subsidy, look at those plans, find one best for their family, and actually enroll. The way the plans are placed on the exchange or the health insurance marketplace was done in a way to allow consumers to be able to easily look at how these services would compare from plan to plan. These are called the metallics, and you may have heard that term before, but bronze, silver, gold, and platinum. The way I like to think about it is the bronze plans are the plans that are going to have the slightly less benefit structure as you move up the chain from silver, gold, and finally to platinum. Those plans are going to have slightly richer benefits, and it's a little bit complicated to explain, but the way example that I like to use is that you need to think of a bronze plan as like a 60-40 plan, which means that the health insurance would pay about 60% of the medical cost. The responsibility of the member would be about 40%. For silver plans, it would be a 70-30 plan. 70% would be the insurance responsibility, 30% would be the consumer responsibility, all the way up to platinum, which would be a 90-10 plan. Now, before you start thinking, wow, 70-30, that sounds still pretty tough because you know how expensive medical expenses can be. And if I'm responsible for paying for 30% of those expenses, that could be a pretty big challenge for me or my family. And although health insurance might help, that 30% could still be a pretty significant problem for an individual. Well, keep in mind that, remember, many of the people that are eligible for subsidies on the exchange, we're going to talk about that in a minute, are not eligible just for premium assistance to help purchase the health insurance, but they're also eligible for subsidies that are covering the copay and the co-insurance and the deductibles. So for many individuals, there may be, even though they get a 70-30 plan, their actual out-of-pocket cost might be much lower than that. It might be more like 5% or 10% based on their family income or their personal income. So how is the government going to actually, through the Accountable Care Act, pay for the health insurance coverage? Well, the three big areas are: one is expansion of Medicaid, and I'll talk about that a little bit more in a minute. The financial assistance, as we talked about in purchasing the premiums, the subsidies, if you will. And finally, either lowering the patient cost sharing or providing some assistance for those copays, those deductibles, and that coinsurance. So on the federal financial assistance, because this is a big important question that you may get as a stakeholder group, is who's eligible for the financial assistance? Well, first of all, you have to be a U.S. citizen or legal resident. So it's not available to people who are not citizens of the United States. Secondly, you have to be ineligible for group coverage or a government program, which basically means, to explain this, is that if you are already provided coverage by your employer, then you won't be eligible for a subsidy on the exchange. And then finally, to get a subsidy, you have to actually enroll through the individual insurance marketplace. Now, I'm going to mention this later. It doesn't mean that you have to do the whole experience there. You may actually go to a company website that links to the exchange, but everyone does have to go through the exchange, either directly or indirectly through a company site, to be able to enroll in the marketplace and be eligible for a subsidy. Now, I've mentioned those subsidies a couple of times, so I'm going to give you a little bit of specifics so you'll sort of know where this falls. There are two types of subsidies. The first is that premium tax credit. That is the ability to help get a subsidy to pay for a health insurance premium. For individuals who qualify for subsidy, that's typically going to be in the either individual or family category of 400% or less of the federal poverty level. Now, so what's that mean? Because it says federal poverty level, what does that mean? Well, basically, for individuals who fall into that subsidy category, to get that tax credit, they're going to have incomes up to, as an individual, about $45,000, $46,000 a year, or for a family of four, about $94,000 to $95,000 a year. And again, that's going to vary from time to time, so probably the exact numbers aren't that important because it's based on the 2013 numbers. But the take-home message really kind of works around that for most individuals who make up about $45,000 a year as an individual, they're going to be eligible for a premium tax subsidy, and that's a significant number of people who are uninsured within the United States. Now, for that cost-sharing subsidy, the requirements are a little more stringent. In fact, that's only going to be available to people at below the 250% or less of the federal poverty level. And just to kind of give you a ballpark again, those are going to be with incomes for an individual of about $27,000, $28,000 a year, or for a family of four, about $57,000, $58,000 a year. That subsidy, remember, is for the co-insurance, the deductibles, and the out-of-pocket expenses that might be available to that particular insurance plan. So what are your steps for getting coverage? And we've talked quite a bit about that today. Well, the first thing that people need to do is they need to review their current coverage and to see how their family would benefit from health insurance. And I opened this dialogue this afternoon by talking about the benefits, about being able to provide safety for your family or for an individual's family, about limiting that risk for a medical bankruptcy. But it's important for people to take a look at a significant benefit that's now available under the Accountable Care Act to see how best it fits their family. The second part is to choose how you want to access purchasing that product. Do you want to do it on your own, which means go to the website directly, which is the system is set up to allow that. You can actually work with an agent, and in many marketplaces there are agents who will help to facilitate the sale of these products on the exchange. And finally, there's something called navigators, and these are individuals who have been designated by the federal government to assist people in selecting and purchasing a policy. They're not insurance companies, they're relatively independent. So their goal is really to provide kind of an independent resource for people picking those plans out on the exchange. The third is you can visit an insurance company's website and to compare plans and purchase directly online. There are all of the plans that are available in the health insurance marketplace. They are built and created by independent insurance companies within the United States, and so many of those insurance companies are going to have those products available not just on the exchange but also off the exchange as well. So if you're not eligible for a subsidy, one of those plans may fit you. So although you don't necessarily need to purchase it on the exchange, you can purchase it directly from an insurance company. But those insurance companies' websites, many of them, if not all, will help to link you to the exchange to help you purchase the product and get eligibility for the subsidy. If you don't have insurance, you're going to be able to acquire it because of those provisions. And remember that the things I've highlighted before, pre-existing conditions don't matter anymore. So that's very important. And even if you couldn't afford it previously because of that pre-existing condition adding significantly to the cost of the premium, you may be able to purchase it now. So it's particularly as a stakeholder group, that's a big education piece, is to make people aware that even though they haven't been eligible in the past, they're very likely eligible now. The health insurance marketplace opened in October, where you could start to review plans, and we talked about the challenges with the website. Many of those have been fixed. People can actually get on the exchange and then start to review those plans. If you want coverage to take effect on January 1st, I'm encouraging people to get on and complete that information as much as possible before December the 15th, because there is a lag in the ability to be able to get the information on the website and turn it around and actually get coverage to be effective on the first day that you would be eligible for coverage. One of the things I like to tell groups is that don't wait to the last minute. Although the process is still relatively simple about picking your plan, for many people and for many people in your stakeholder group, this may be the first time they've ever had the opportunity to purchase health insurance, and certainly maybe the first opportunity they've had to make those decisions on their own. So I encourage people to go to the website, check it out, find the information that may be required to make those decisions, and then start to think about what product would be best for their family. The sixth thing that's mentioned there has to do with you're going to have to answer some questions to see if you're eligible for funds. And that's why I'm encouraging people to go to the website as soon as possible to see what kind of documentation you might need, or what information you might need to review about your family to determine whether or not you would be eligible for subsidy, and what you would have to fill out to make those decisions necessary. I've enjoyed this conversation, and we've certainly covered a lot of information, but I'm looking forward to the opportunity to answer your questions. Certainly, if you have those, you can turn it back over to Kelly in a minute, and she's going to direct those questions to me. If you have further questions about information that you might want about the Accountable Care Act or about a member's options for accessing their provisions under the Accountable Care Act, or if something was a little bit confusing today, the website that we direct people to is becoveredtexas.org, and that's becovered, BECOVERED, Texas.org, and that website contains a whole host of information related to the Accountable Care Act, and particularly information on educating consumers on how to access the opportunities that are available. So again, thank you for the opportunity to visit with you at lunch today, and I look forward to engaging and answering some of your questions.
Dr. McCoy, thank you so much. Great presentation, lots of information. I know that we will have lots of questions and also lots of follow-up questions. So we will get started with the Q&A. And I'd like to start, the very first question is, this presentation, I know you your focus primarily was on Texas and being able to provide the becoveredtexas.org website. If we have viewers or participants who are not in the state of Texas, which website would you recommend for them?
Well, I would still go to the becoveredtexas.org website and access the information there. I think that would be a great resource, and there's links on there, I think, which can help provide the information that most people would want.
Okay. And give me just a minute, because I see hands are raised, but for some reason I'm not seeing the questions being typed. So what I need for you to do, if you can type your question in on the side panel, and we will answer your questions as they come through. So just a reminder, your questions can be typed on the chat, and they will be answered in the order that they are typed. And Dr. McCoy, again, on behalf of Sisters Network, we want to thank you. We do have some persons that are typing questions, so as soon as those questions are visible, we will go ahead and ask those questions. But in the meantime, I know there's been a lot of talk in the news as it relates to the website and being able to access the portal and to make that selection. How do you have any comments or just words for participants online to kind of encourage them to be active and just continue on to as we work through the process with the website?
Well, I think that the first thing I would encourage people to do is just to encourage them to go check it out again. I think there was a lot of initial attempts, and clearly there were some challenges around the website access for many consumers. I think the government has worked very hard to correct those. And so although that people may have had a little frustration initially, I would encourage them to go back and check it out again. And again, I try to end my comments earlier by saying, don't wait to the last minute. You want to make sure that you get on there and get the information as soon as possible. Just because you may have questions, and you may actually have to go back and access that information again.
Okay, we do have one. A first question is, what is the Affordable Care Act enrollment deadline? And the next question, I guess, pertains to that. I think is the deadline December 15, 2013. And if you miss that deadline, does it mean you cannot get covered? So is that correct? Is the deadline December 15th?
Yeah, so let me kind of clarify a little bit of information about that. First of all, the open enrollment for the marketplace will continue until March 31st, 2014. Okay. Now there has been some talk about extending that open enrollment period, but I would encourage people to focus on the March 31st deadline. There's really no reason for most people to need longer than that. You can actually go on the website, start the enrollment process now. We've historically had a deadline of telling people that they needed to get on and get the information done by December 15th to have coverage on the first available date of eligibility, which will be on January the 1st. consumers, that has been changed, and consumers now have until December 23rd, so they've actually lengthened the time frame just a little bit to allow people to get the coverage that will be available on January 1. Now, you can sign up after the 15th or after December 23rd, and you will still be eligible for coverage. But if you want coverage on the first date of eligibility, which is January 1st, then you need to do it by December 23rd. Now, again, the website is fairly simple to access. Once you get on and you get access and you start to answer the questions, and you can determine which product is best for your family. But I would encourage people to not wait till the last minute. You do not want to treat this like holiday shopping and wait till December 23rd to start the process. You want to start the process now. So I would encourage people to go get started now. You will have until March 31st to do this open enrollment period.
Dr. McCoy, what is the actual website to go in to sign up for the
It's healthcare.gov.
Healthcare.gov. That's healthcare.gov.
That's correct.
Okay. And that question was from Ms. Chantel Doyle. That response is healthcare.gov. Annette Douglas, if you do not meet the 12/15, well, we've already answered that question. You focus on the 3/24 deadline.
Yes, it's actually December.
Okay, next question.
It's actually December 23rd, and I think that there's a great question there. Does that mean you cannot get coverage? And the answer is no. You have up until the March 31st deadline to go through open enrollment. So you can get coverage after that date, but it won't be effective on January 1st. And it's important for people to know that these are truly insurance products, which means that you do have to enroll in them before an event occurs. So you can't have, say, a significant health event on January 1st and then decide in mid-January to retroactively enroll. It doesn't work that way. You actually have to enroll. You have to enroll as an enrollment process, just like you're purchasing a traditional insurance product.
That's a very valid question and a good response, because we want to encourage people not to procrastinate with this process. The next question is, Ms. Brenda Powell, is the presentation available for download? Yes, Ms. Brenda, the presentation will be available on the Sisters Network website by Friday. It will also, a link to the presentation will be emailed to you along with the presentation evaluation. Evelyn Rosales from Parkland, Dallas. Can an individual become an application counselor?
Well, that's certainly not my area of expertise, but I know that there are provisions available from Health and Human Services for people to become application counselors, and I would probably direct that question to them.
Okay. This is a good question too, Dr. McCoy, from Veronica Sesson. If just starting a new job and not eligible for group insurance for 90 days, is there a requirement to purchase insurance on the ACH website in the meantime?
You know, that's a great question, and I don't know that anyone's ever formed the question exactly that way to me before. I think that where I would direct the answer to that question for that individual would be to the HR department for the employer. I think the answer that I would probably tell that individual is, it's not the mandate that would concern me more. It would be the fact that you would want to have coverage, right, in case you were to have a health event occur. And I would probably talk to the HR department of your new job and find out what their recommendations are on either acquiring individual coverage temporarily on the marketplace versus what options are available within that employer.
Okay. Carolyn has a question. Are all insurances required to participate in the pre-existing enrollment program?
Well, the mandated changes that occurred as part of the Affordable Care Act have to do with applying to all insurance products that are sold both on and off the exchange. There are certain products that are excluded from some of these provisions if they are considered grandfathered, meaning that they were in place without significant changes but by a certain deadline. But for most, if not all, of the individual products products that are sold in the United States today, they must meet the criteria as outlined in the Accountable Care Act, which means that they do have to not prevent a person from enrolling or charging a higher premium because of a pre-existing condition. And she asked specifically about United Healthcare, but I'm not familiar with their product.
Right. Okay. Thank you so much. April Powell Martin, if you want to ensure continuity of care with the current provider you are seeing, how will you be able to determine if your physician is available?
Okay, first of all, that is a great question, and I really appreciate the opportunity to ask that because I probably should have mentioned that when I was talking about selecting a plan. But when you go on the health insurance marketplace and you go through those steps about, are you eligible to purchase? Number two, are you eligible for a subsidy or financial assistance? And then you start to look at those metallics, the bronze, silver, gold, and platinum plans. One of the parts of the plans that you want to be careful about is, do those benefits, are they good for you or your family? And part of that's going to be, everybody tends to focus on the cost. Are we going to be able to afford it as a family? What's the copay? What's the coinsurance? How's the subsidy going to be applied? But a significant other variable to look into is, what is the network of physicians and hospitals that are a part of those plans? And they are going to have some significant differences among the plans that are available on the health insurance marketplace. You're not necessarily going to be able to have every hospital and every doctor within those plans. So there's going to be links to those network descriptions available, and I would encourage, if you have a physician that you've seen for a long time and there's strong continuity of care, and now you're on the marketplace looking to purchase a product, that is one of the questions that you would want to ask yourself and do the research on the website before you pick that particular product. It could be that a physician or hospital is not available on any of those plans. That's rather unlikely. But it could be that you might have to pay a different premium or choose a different metallic category to find the plan that would have that position or that product available. But great question.
Thank you so much. And great response and very thorough. I appreciate you responding to that question. The next question, is Dr. McCoy available to make this presentation to other organizations?
Absolutely.
So that would be a Dr. McCoy question.
Absolutely. I mean, this is what I do most of the time, is I go around and talk to groups and try to spread the word about people's opportunities and about the Affordable Care Act. So I would just encourage you to contact my company, and we'll see what we can do to help provide information for you.
Thank you. And what I may be able to do, Dr. McCoy, would it be okay when I send out the reply email to give them Hillary's contact information?
Yep,
is that the best way to reach you?
Absolutely.
Okay. We'll do that. Okay. Tanya has a question. What if I have a pre-existing condition, am currently covered, but insurance is changing? Can I elect to enroll and be covered, or must I elect insurance through my job?
Okay, so a couple of things I'll clarify about the question. First of all, Be Covered, the logo that you see on our slides, is actually a program that is not an insurance product. It's actually an organization that was put together and formed, and it's been funded by Blue Cross Blue Shield of Texas, but actually it's really formed by stakeholders who have agreed to participate in raising awareness around the provisions of the Accountable Care Act. So when you actually talk about enrolling, you would actually be enrolling through healthcare.gov or through one of the insurance sites. The other question had to do with if you had a pre-existing illness and you're covered, but your benefits are changing with your job. Well, that's a little bit of a complicated question, but I'm going to try to provide a little bit of clarity. If you are offered what's considered affordable insurance that has a minimum value, which basically means that it covers the required services at the required benefit structure as outlined within the Accountable Care Act, then you are typically not eligible for a subsidy on the health insurance marketplace. It doesn't necessarily mean you cannot purchase an individual product, but you may not necessarily be eligible for a subsidy. What I would encourage you to do is to review the new health insurance that's being offered by your company and find out what would be the best option again for you or your family based on that benefit in comparison to what might be available outside the exchange. But the thing I think I would really be important for you to understand is typically if you already have health insurance and it's being provided either by government, such as Medicaid, or if it's provided by your employer, you're typically not eligible for a subsidy on the exchange products or the health insurance marketplace.
Okay. Thank you so much, Dr. McCoy. And I think that's actually I think Gloria is typing. Let's try to get her question in very quickly. Um, Tanya, okay, there's a question from Crystal Bolton. It is my understanding that the state of Texas is now participating in the expansion of Medicare. Would these individuals be eligible for subsidi- maybe subsidies and cost sharing benefits? Will they have to pay the penalty?
So that's a good question, and let me kind of talk about it just broadly and not really specifically about Texas, but I think it's a great question. So clearly there were three ways of providing the financial assistance for people to have access for providing access for the health insurance. The first one had to do with obviously the premium subsidy and the cost sharing subsidy. Those are the two provided government assistance. But the other one was expansion of Medicaid to cover people that are below that 133% of the poverty level that might be down to and including the early part, the higher income units of people that were on Medicaid. Certain states in the United States have elected to not expand Medicaid to cover that gap of members, and that clearly has created another gap for people who are not necessarily going to be covered by Medicaid and not going to be eligible for a subsidy. Texas was one of the states that elected not to expand Medicaid. As far as paying for the penalty, I'm not sure I'm really the right person to answer that particular question. But I would tell you that the penalty is based on income to some degree, and certainly the income of those individuals in that category would be low. So I'm not sure that the penalty will be substantial.
Okay. Um, Thank you for that response, Dr. McCoy. There's another question and follow-up. Erica says she wasn't quite clear on if starting a new job and you are eligible for group insurance, but the insurance is very expensive, would you be eligible for this insurance? Meaning, I'm going to assume, Erica, and you can correct me, would you be eligible for one of the healthcare options under B
That's a great
coverage?
question, and I'm sorry if I
Okay.
wasn't clear. The way to think about this is that if you are eligible for coverage, okay, by an employer, then generally you are not eligible for a subsidy on the health insurance marketplace. Now, there are certain guidelines that employers must follow in providing group health insurance for their individuals. If not, then the employer has to pay a penalty. Okay, so most employers, I'm not going to say all, but most employers are trying to fit their benefit packages within those boundaries. And those boundaries are that the product has to be affordable, which means it has to meet a criteria for a definition of affordability. In other words, affordable for the employee that's working for the company. And secondly, the product has to be minimum value, which means that it has to offer a level of benefits that the government has deemed to say are minimal. And those are the two criteria. So yes, those group insurance might have historically maybe have been more expensive, but again, going forward, the group insurance has to meet those two criteria. It has to be affordable and it has to be minimum value, or the individual is eligible to go to the website and apply for a subsidy, and the employer has to pay a penalty. I hope that answers the question.
Okay. I think it was kind of a two-part question, I think, and I just emailed her and she responded. Yes, what she's trying to figure out is what are her options during that 90-day waiting
And I
period.
guess that was the answer that I gave, is that what I would encourage that person to do would be to talk to the HR director of the company that they're working with and ask the HR director to provide some guidance.
Okay, okay, yeah, he says okay, thank you. She said thank you. Okay, well, Dr. McCoy, that
Well,
seems to
thank
be
y'all
the
very.
last question. Did I forget? Oh, I'm sorry, one more from Gloria Burton. Well, hold on, Dr. McCoy, we have one more, and this is a really good question from Gloria Burton. How are people who are typically using the free county services
That's a
affected?
great question. And I guess the question would be, why are they accessing the free county services? If they're accessing the local government or free county services because they have not had access to health insurance in the past, then those dynamics within that individual and that family may have changed. Many people who have been ineligible for health insurance in the past because of a pre-existing illness, or they couldn't afford the health insurance, they may find that because of the removal of that pre-existing illness clause and the fact that they may be eligible for both a premium and a cost-sharing subsidy, that now they qualify for insurance. So although they could elect to pay the penalty or avoid participating in the health insurance marketplace and continue to access those services, they also may qualify for insurance, which would provide them the safety and the opportunity for access that they may not have been able to have before. So as far as accessing those services, it kind of depends on the individual and whether or not they qualify for a subsidy and whether or not they go through exploring their options on the marketplace.
All right. Gloria, I hope you were able to, that answered your question. Dr.
Well,
McCoy, we want to thank you
thank
so
you
much for
very much.
taking
Y'all
time
have
out
a
of your
great
busy
day.
day
I really appreciate the
to.
opportunity to talk to you today.
And thank you so much. And any follow-up questions and information will be directed to Hillary in your office. Again, thank you so much for your
Thank you. Y'all have a
participation
great day.
today. Have a
Thank you.
great one. Thank you. Okay, thank you so much for participating in this afternoon's webinar brought to you by Sisters Network Incorporated, the only national African American breast cancer survivorship organization. We want to thank you for your participation and support, and please continue to spread the word about our Webinar Wednesday series. We do have 3 webinars in the future. January 15th, New You, we will be talking about, I believe it's diet, I'm sorry, it is healthy eating and living, health, beauty, and skincare. In February 19th, loving me, loving you, breast cancer, sexuality, and dating. And March 19th, food for your soul, fertility, pregnancy, and motherhood after breast cancer. And we're always looking for new topics and subjects that appeal to our audience, our survivors, our network. So if you have any suggestions or if you have any additional questions in reference to today's webinar, please send your questions to social media at sistersnetworkinc.org. Again, that's social media at sistersnetworkinc.org. Also, we will have information in an email coming to you later today, or no later than Friday. We will have an evaluation. Please complete that evaluation because that helps us continue to provide great service and information to you. Also, we will provide you with a link to view this website, to view the webinar on our YouTube site. So again, on behalf of Sisters Network, our affiliate chapters, our national board of directors, and our medical advisors, we want to thank you so much for participating. And if you haven't already done so, don't forget to register for the 5th National African American Breast Cancer 5K Walk Run. Stop the Silence Walk will be held on April the 5th, 2014 in Houston, Texas. But if you're not in Houston, you can also support by starting the team online and supporting that way, raising funds, making donations, soliciting donations on behalf of someone that you know or someone that you love, or you yourself who has been affected by breast cancer. Early bird registration ends on December the 1st, so you want to take advantage, I'm sorry, December 31st, so you want to take advantage of that. Again, thank you so much for your support of Sisters Network Incorporated, and we hope to see you or hear you again on January 15th for a new you, healthy eating and living, health, beauty, and skincare. Thank you so much. Have a great afternoon.